Welcome to the ANEW Body Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogrammed Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. And Chantal Donnelly, physical therapist and author of Settled, How to Find Calm in a Stress-Inducing World. Here at City Club Los Angeles, we follow our guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome to the ANEW Body Insight Podcast at City Club Los Angeles. I am Dr. Supatra Tovar, and sadly we do not have my co-host Chantal Donnelly with us today, but she's with us in spirit and we are carrying on in her honor. I am so excited to have OBGYN to the stars, Dr. Gail Jackson with us today. Welcome.
Thank you so much.
Yes. Well, I'm going to read a little bit about Dr. Jackson, and then we are going to get into our questions.
Perfect.
Dr. Gail Jackson completed her undergraduate and medical education at Howard University. She completed her obstetrics and gynecology residency training at the Los Angeles County Hospital System. She established her private practice at Cedars-Sinai Hospital. While focusing on comprehensive obstetrical and gynecological care, she performed female gynecological surgeries, vaginal restoration, and delivered gorgeous and healthy babies. She is well respected and revered in her field among her peers and celebrity clientele. For the last 15 years of her practice, Dr. Jackson has become a pioneer in perimenopausal and menopausal hormone balancing because she realized the options were very limited for women to feel fabulous throughout life. Thank goodness for that. Dr. Jackson desires to always offer the latest, safest, and effective methods of therapies as her patients transition into their 40s, 50s, 60s, and beyond. Her present focus is exclusively anti-aging and wellness utilizing integrative medical principles. Along with hormone balancing, she supports the whole woman with Forever Fabulous, a weight loss and hormone balancing plan, the Lady Lift, which utilizes platelet-rich plasma for vaginal rejuvenation and bladder support, and her practice promotes sexual wellness to keep her patients feeling fabulous through the best of their lives. Dr. Gail, we're really honored to have you here today. Thank you for joining us.
Thank you so much for inviting me.
Yay.
Happy to be here.
Well, we're so glad.
Traffic's crazy, but I'm happy to be here.
It's Los Angeles, so traffic, you know. We really want to know how you transitioned to, your focus on perimenopausal and menopausal hormone balancing. You were in the obstetrics field, delivering babies, doing that primarily. What was the, inspiration to transition out of that and more into this side of care?
My inspiration for my transition was my patients, because my patients were getting older, and I had patients and girlfriends who were older than me, and they were miserable.
Yeah.
And so I felt I had to find something that was safe, effective for them during this part of their life, and selfishly for me, so I would have something for me when it was my turn.
Right.
Because what was out there was fraught with complications and side effects that were not acceptable.
Yeah. So give us a picture of what was before and what is now. How has it changed? How is it safer? What's different about what they did before and what they're doing now?
Well, a lot of before is still out there in the Western world. So my board certification and my training is in Western OBGYN traditional, and I was once a naysayer. But I realized there had to be something else because I did not find the answers that I needed in what was available to me. Mm-hmm. So then we made the transition to functional medicine, regenerative medicine, and there's a wealth of information there. Yeah. So in the Western world, there's synthetic hormones. There are some bioidentical, but they're basically synthetic hormones, and they're fraught with all the side effects that you hear on TV.
Right.
Patients ask me every day, is this going to do this? I said, no, these are plant-based. Those are synthetic. It's not going to do
Right.
that. So we transition. So we let go of all the synthetic options. We have plant-based options, and we also added testosterone because testosterone is really not available in the Western world for women.
Right. Were you one of the people that actually introduced testosterone therapy to the Western world?
Oh, no. No, I just did the research. There's lots of information out in the functional medicine world about hormones and balancing.
Give me a picture of what people were experiencing before and how plant-based hormones especially are more beneficial and helpful.
Well, before 2001 specifically, a woman went to her gynecologist and complained of symptoms that suggested she was in menopause. And if she were 47 to 51, it was primarily the hot flashes that drove her to the door.
Right.
So a doctor would prescribe her a one-size-fits-all, Premarin, 0.625 dose, and a Provera, which is an archaic progesterone, to protect the lining of the uterus from the estrogen. And she would be on her merry way with prescriptions for a year, and all was well. However, first of all, there are ladies in their mid-40s who have nagging symptoms of irritability, mood swings, low libido, weight gain, fatigue, difficulty sleeping, difficult memory, brain fog,
Yes.
just not feeling good.
Yes.
And those ladies were just given a little were just pacified by their doctor, perhaps given a prescription for Valium or some other relaxant, told them to rest more, and they would be okay. So most of those symptoms are associated with low testosterone.
Oh, wow.
We all know about estrogen. And the reason I knew this, because I was always very interested in this. And there once was an estrogen pill that had a little touch of testosterone. And so my patients who were very difficult to manage, sort of brittle or difficult to get relief, when I gave them that pill, oh my God, they were so miraculously better.
Wow.
So I never forgot that. And I said, there is something to this testosterone. So most people, oh, no, testosterone, that's a male hormone, but women need just a tenth of it. And a tenth of it's life-changing. So women initially had the synthetic estrogen, the archaic and synthetic Provera, and they were all taken off the market after the WHI study. And then they transitioned into, those who sought help, transitioned into hormone balancing, plant-based, because women are smarter. They demand the answers. They didn't just settle with the doctors in 2001 saying, you can't take your hormones anymore. I hope you feel better. Maybe you rest well because I can't give you a prescription for Premarin anymore because of this WHI study that says you'll get cancer.
Wow.
Okay, so, and he says, I hope you feel well. Well, women were still miserable, and fortunately, we are smart, we are inquisitive, and women sought the help, the results that they needed. They sought the information that they wanted and then the results they needed.
I think it's really sad that women have to advocate for themselves in a way that men never do. You see a lot of, medical research focusing on men, less on women. So, good on us for doing that, but it's, it's really disheartening to hear that. Testosterone, that's something I think a lot of people don't even know is an option for them. Tell us specifically what that does to help with the menopause symptoms.
Well, some of the little irritating, nagging symptoms that you just thought you'd have to live with are associated with testosterone deficiency.
Wow.
For instance, we have patients that simply come in and say, I can't lose this weight. Where's my body? Where are my curves? I had a waistline. Where is it? I can't sleep. I'm so edgy and irritable. I snap at my kids. So those ladies are usually experiencing symptoms of low testosterone. So when you draw your labs, and I always like to let ladies know is we use labs just to get results we need. We don't look at their normals because their normal is not the optimum norm, is not the normal for your optimum health. So we have values that that are good for your optimum health to make you feel amazing.
Right.
So, for instance, if someone comes in and she has some labs, and let's say she's 51 years old, and her estradiol, which is the circulating estrogen, is 10, your lab says normal. Well, 51-year-old women are not making estrogen. But my God, we're not trying to make you feel like you're 51. We want to make you feel like you're in your mid-30s to early 40s, because that's the most disease-free time in your life.
Wow.
Who do you know that's ill? 30, very rarely, because hormones are protective against illness.
So estrogen, if testosterone is responsible for the weight gain, the brain fog, just not feeling yourself, estrogen is responsible for the hot flashes?
Specifically, hot flashes, night sweats, dry skin, dry vagina, and crepey skin, the dreaded crepey skin.
Yeah, creepy skin. Nobody wants a creepy skin.
And the long-term benefits, osteoporosis. I'm sure everyone knows a grandma who fell in a nursing home and who succumbed to the fall because the immobilization, the osteoporosis. So she fell, broke her bone, broke her hip, and so then she has to be immobilized. Wow. So when she's immobilized, she develops a urinary tract infection or some kind of infection or blood clot, and women often die because of the consequences of thin bones or osteoporosis.
Ay, ay, ay.
And Alzheimer's and dementia.
Ooh.
Yes. So testosterone and estrogen together are important for the prevention of Alzheimer's and dementia. Ooh. But I think the best benefit of everything is sleep.
Oh my gosh.
You cannot
agree more.
You cannot function if you don't sleep.
Mm-hmm. I encourage all of my clients to prioritize sleep above anything else, because we know there's all sorts of processes that happen when you're sleeping. Your brain actually gets cleansed of, some of the tangles and the plaques. Your liver has a chance to help, direct the, production of hormones, all of those things. So sleep is essential. And is it like chicken and the egg? Does the testosterone help with the sleep? Does sleep help with testosterone and your other hormone production?
No, testosterone helps with the sleep. So we find these women are significantly deficient in testosterone. Okay. So many come just because they can't sleep. And with hot flashes and night sweats, throwing your clothes off and covers off every few minutes, a woman can't sleep.
Wow. Okay, so you're, definitely explaining this, hormone balancing. And progesterone, does that play into it as well? Do you need to supplement with progesterone in menopause?
Progesterone at this time is not a supplement. For the menopause, it protects the lining of the uterus from the effects of the estrogen. Oh. But Prometrium is plant-based, and you can get it at your retail pharmacy. So when we use the progesterone in the form of Prometrium, it also helps you sleep. That's an added benefit.
Ugh, there's so many benefits. Mm-hmm. I'm curious, too. You have a comprehensive approach to wellness, and this, includes these integrative medical principles. But I'm also wondering, do you also encourage, besides sleep, any other natural ways to manage through menopause? Any, dietary recommendations that you might recommend to people?
That's usually not our world. Usually folks, women have figured that out, and they're just like, I've tried everything and I'm not feeling better. So women come to us after they've tried everything. There's supplements at your retail pharmacy, at your health food pharmacy, that promote sleep and rest and their activities. We all know yoga, we know mindfulness, those things. So when women are not feeling good or feeling they're optimal, after exercising all and utilizing all of these other opportunities, they usually seek us out.
I see. And so that's, the Forever Fabulous program. Give us a picture of what that actually looks like. What can people expect if they're going to go into you and, join this program?
Well, in our office, we offer a few things. We offer a weight loss program using HCG, which is bioidentical. We offer the hormone balancing. And so the Forever Fabulous is usually for ladies who need to lose minimum 50 pounds.
Okay. So
we encompass everything we do and then package it. So it's 2 months of the HCG, which is a hormone of pregnancy. Many people are familiar and have taken HCG before, and you lose weight very quickly. And during that time, we balance your hormones, we balance your thyroid, and the women who have done our Forever Fabulous program, which is a 3-month program, have lost 40 to 50 pounds. So it's reserved primarily for women who need to lose 40 to 50 pounds.
I see. What about after the program? What happens? What do you suggest for them? Or do they see any kind of weight rebound afterwards?
Usually they have the aha moment. And what's the aha moment? I didn't realize I was eating way too much. I didn't eat nearly as much food as I was eating. So we also have something we call, it's a Celebrity Fit Food Guide or weight loss guide. And it just gives you simple tips that women who are not needing this automatically do.
Do you say that just kind of categorically, or do you also promote people to like really tune into their bodies? That's something I do in my practice, because I deal with, a lot of people who've been kind of victims of diet culture. I treat people with eating disorders. And, I think a lot of people react poorly to rules. Mm-hmm. You can only eat this, you can't eat that, you have to diet like this. And that kind of leads to difficulties with eating. Mm-hmm. And so I like to promote mindfulness because it's about tuning into your body and listening to your body's cues. Do you offer tips in that area as well?
I think indirectly, because when you're only eating this amount, you're more sensitive to when your body says, I'm full. Mm-hmm. And instead of eating it, because as you know, this is your area of expertise, people eat emotionally because they want something in their mouth. Mm-hmm. You want some chips, you want something in your mouth, which has nothing to do with hunger. Mm-hmm. So it helps teach women understand if I'm hungry or not. There's a long list. I just pointed out one. But there's a long list of tips. And the majority of our ladies, unless they did it for an event, so we've had ladies do it for the Oscars or something, unless they do it for an event and they look at it as a lifestyle change, which is what we encourage them to do, they keep the weight off.
I see.
Yeah.
Well, I'm sure, and there's so much pressure within celebrity clientele to be a certain way. So there's, a lot of incentive to listen to that. I also wonder with, people who aren't in that realm, how do you encourage them to keep these habits if they don't have something like you're going to be on camera, at the Oscars? What kind of incentives do you give them to continue the program?
Well, our ladies who select these programs are not our celebrity clients because they already have figured it out. They've been needing to do this for years.
I see.
Okay, so our ladies are a woman who comes in and I don't know how I picked up 50 pounds and I need your help. Mm-hmm. So usually we find that her hormones imbalance and it's a lot of education that she was not aware of. Mm-hmm. Everything in my office I've done and I needed, and I've always been that girl who's needed it. I've lost and kept off 30 pounds.
Wow.
Yeah, and I was never large. I was like an 8'10", 8. I'm a 4 now. So there are a lot of tips. So I share from my experience. And so that helps. And because a lot of it for our ladies is education. Yeah. And a lot of it for me was education.
I'm curious about your experience. You said that this was a big inspiration for you to go into this. What exactly did you experience as you were going through perimenopause and menopause? And how did you overcome it?
Well, I remember the night, and I named her someone else in my book. I was single then. I was out at a fabulous Christmas party, and hair, makeup, everything, dress, just amazing. And I was standing in the middle of the floor, and I remember dribbling down everywhere and just down, I felt to my ankles. I felt like I was in a puddle. And that was my first hot flash. I will never forget it. And wow. I vowed I will never have another.
Wow.
And I was pretty young when I had that first one. So they didn't come frequently, but I said, I will never, ever experience that. So that really catapulted me into my personal investigation to find the answers for myself and for my patients who needed me at that time.
Yeah. I have to say, I'm 51 and I haven't had a hot flash yet. And I'm wondering, what's the deal?
Well, some women, unfortunately for her patients, I have a colleague who never felt a hot flash and has no idea what we're talking about. Mm-hmm. So unfortunately for my patients, I was miserable. So I understand.
Yes.
So it varies. Majority of our patients are somewhere in the middle. Mm-hmm. The ones who've never experienced anything or there's a cultural component to it. And this was informative to me, and it's actually more in women of color than anything else, because there's not I don't know if you've been in the South, there's not a Southern church that doesn't have a fan with a funeral home on.
Yep.
And women just span, and it's a transition of life, and it's thought to be normal.
Right.
So it's really important to just listen to the patient. So in other words, when women need me, I let them come to me, because I made the big faux pas a couple of times, and then I'm like, no, never more. I was at an event, I had my card about hormone balancing, which is about this size, and I happened to have some in my purse, and this woman was just dripping. And I said, oh, read this, and come to me. And she looked at me and she said, these are not hot flashes. And that happened twice. So I said, but then there's also many, many others that I'm like, look at this, come down. Like, oh my God, this is what I've been waiting for.
Yes. I mean, so many people I know have, had a really hard time.
Right.
I mean, our co-host Chantal talks about it a lot. My sister's had them, and a lot of friends have had them. And I'm wondering too if, dietary choices might play a role in that. I mean, I've done a lot of research on the blue zones. And the blue zones are fascinating to me, where they have the largest proportion of centenarians in the world in these 5 different areas. And what's fascinating to me is that in Okinawa, one of the blue zones, they don't even have a word for menopause. And they think, research is showing that it may have to do with the amount of soy and seaweed in their diets. And so I think that for me, once I, hit around 50, I was like, I don't want to experience this, so I'm going to add a lot of soy to my diet. So I don't know if that might be a reason why. What have you heard about adding soy to the diet?
Well, it's not what I heard, it's what I know. But soy is a phytoestrogen.
Yes.
So soy basically is estrogen. So you were taking estrogen.
Yes.
In small amounts. So so some women do well with that. As I said, there are many women who do well, and they take supplements and whatever. I don't see those.
Yeah.
So it's those that when they've tried all of those, they come to me and like, you've got to help me.
So for some women, what you're seeing is they've tried soy, they've tried changes in their diet, and it doesn't work. It's primarily a hormone issue.
There's specific supplements that help menopause, and women Google them. Black cohosh has amazing results, as you know, primrose oil and soy, and then what's the other one? Black cohosh, primrose oil, Dong Quai. Okay, so women may go and select that, and sometimes there are pharmacies that provide a combination of them, and they'll try those.
Yes.
So they may get results, or they may have a hot flash once and it'll pass. Just like women are different, their experiences are different.
Wow.
So I think as well as I know, we have to just listen to them and see what their desires are. So I no longer recruit patients. I let them find me, because I feel I actually have a meeting that I attend all the time, and there are women in their early 50s, and they sort of marvel at the different fans they have. I mean, I would never sit anywhere with a fan in front of me, but she's like, oh, come here, let me show you mine. And I'm like, whoa, I would never. But you see what I'm saying? So with many women, especially women of color, and someone wrote an article about it, and as a woman of color, that enlightened me that they think it's a rite of passage. Yes. That there's nothing wrong and nothing that needs to be treated, nothing needs to be fixed. Women have hot flashes as they go through menopause, and that's just a transition, and you go through it and you're good.
But you're here to tell everybody.
Well, not everybody. I listen to people, and as I said, I let people come to me for answers when they're not getting the results they desire and they're feeling miserable.
Wow.
Then I also remind them, because what I always hear is, oh, that menopause saying, I've done that, I'm gone through it. However, they're not aware of the long-term benefits. So once the hot flashes are gone, their long-term benefits, I suggested them earlier, the prevention of osteoporosis, protection of your heart, protection of dementia and Alzheimer's. Because that's individual. To me, one of the most attractive features I feel I have is my height. I love my height. I have 2 girlfriends. We used to be all the same height. They're at least 6 inches shorter because they never took hormones. Wow. So you see the bone matrix thin, and women naturally get shorter. And the long-term consequences. And if you've ever experienced anyone in your family who've had Alzheimer's or dementia, you definitely want to protect yourself from that.
Absolutely.
And there's studies now. The best thing, which is so great for us, is daily I see a study. Daily I see a comment. Like we're finding hormones are protective of dementia. We're finding this. And like, wow. I also ran across my feed the other day that talked about how important hormone balancing is to weight loss. And I'm like, oh, I've been trying to say this. Thank you.
Yes.
Women are reading it and seeing it.
Yes.
Yeah.
Well, you're definitely a pioneer in this field, and I think we're so fortunate that you have this passion. You were able to do this, for yourself, and that you're bringing it out to other people.
Yes.
And, of course, having women come to you, but you are the expert in this, and so we are so grateful to have you in this. We are out of time for this half of this podcast episode, but we invite you to come back next week for the second half of this amazing interview with Dr. Gail Jackson. Thank you so much for joining us.
Thank you so much for having me.
Thanks for tuning into the ANEW Body Insight Podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Body Insight Podcast tab. Follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.